This episode is sponsored by Optimum Healthcare IT, a best-in-class healthcare IT digital transformation and consulting firm based in Jacksonville Beach, Florida. They offer comprehensive services, including enterprise application services, digital transformation, and workforce management, which includes their Optimum Career Path Skill Development Program with a leadership team of experts. Optimum provides tailored healthcare consulting solutions specializing in large-scale initiatives like EMR implementations, ServiceNow, and cloud migrations. They empower healthcare providers with advanced IT solutions, seamlessly integrating technology to enhance patient care and streamline processes, shaping a future where technology and healthcare intersect. For more information, check them out at thisweekhealth.com/optimum. I'm Bill Russell, creator of This Week Health, where our mission is to transform healthcare one connection at a time. Welcome to today's Solutions Showcase, where we spotlight innovations making real impact in health systems. Let's take a look at what's working today. Mari, while we have some time, why don't you introduce yourself, give a little bit of your background, and then I'll get us going in a minute or so.
Sure. Thanks for joining, everyone. Just to get us started, I'm Amirah Centinario. I'm the Executive Vice President with Optimum Healthcare IT. I oversee our advisory services practice, and one of the main areas that I oversee is mergers and acquisitions. And so my background, to give a little bit of context, I am former Epic, started in the industry about 16 years ago. I've been a consultant at every level, analyst up to project director, both in the US and Europe. I've also spent time at the Big Four doing strategy consulting. And the last handful of years, I've been internal to consulting firms doing this strategic oversight of large scale implementations, as well as anything strategic like pre-implementation planning, application rationalization, TCOs, you name it. So excited to be here, Bill. Thanks for inviting me.
Looking forward to the conversation. This is interesting. This comes up a fair amount in our 229 meetings, this whole concept of how do you make it through the M&A process and what does that look like, both from the acquiring entity and from the being acquired entity, and how do you get to that single medical record? I've heard, in fact, there was one of the meetings was really fascinating because one of the CIOs was talking about they have I'm going to say 60-day just to be kind, but I think it's like a 30-day, like from the moment the deal is done until the new system is on the new medical record. I think it's 30 days is what they had. And they just have a very cookie cutter process. And generally, they're not acquiring health systems that are in distress. And that's really where I want to start with you. There's any degree of trauma that's going on, right? There's very distressed, like, I just acquired this thing because the state asked me to acquire it, all the way to, hey, we're, this smaller health system, we're just going to acquire them. And instead of being Community Connect, they're now going to be, part of the main build. I mean, is that an accurate depiction of the kind of challenge that exists, a certain amount of trauma associated with M&A?
Yeah, I would say that there's two trends in the market nowadays. And I think for anyone on any part of that gamut, M&A is becoming faster because the sooner that you can fold them in, the sooner you can realize the revenue cycle benefits, have, continuity, patient care, et cetera. But what you're seeing more and more of are acquisitions of distressed entities, because there's a lot of acquisitions done that are now failing. So other folks are stepping in to either be told to acquire by the state, or they're coming in and seeing a business opportunity to acquire those entities.
Back when I was CIO, I'm going to say this and you're going to cringe, but they used to do deals without including IT, and the deal would get done and it would say things like, you can stay on your EHR if you'd like. And I'd be like, how did you agree to this? Like, how are we going? And immediately they're pushing for efficiencies, but we had to figure out how to create the connectivity between the two EHRs and all the mess that exists when you have multiple systems. We've moved away from that, haven't we?
We have. Yeah. I mean, everybody now wants to integrate. The EHR is definitely at the nucleus of this merger and acquisition activity. But I would say, like, your long lead items and the things that end up taking most of your resources and planning fall into, the technical bucket or the third party bucket as well, because we have to look at the entire infrastructure, both on the application portfolio and on the physical infrastructure side of things as well.
So what is the long pole in the tent when you have these two entities coming together? And when can you actually start the work?
Yeah, so I was trying to avoid the term long pole in the tent because I tend to overuse it. So I was trying to go long lead
Well,
item. Since you started it,
I
Bill.
used it, and I'll probably be. I'll just say AI for right now, just so if it happens to come up, I'll be the one who brought it up.
No, it's all good. So yeah, so as far as when you can get started, depending on how it goes, a lot of times if there is a distressed entity, the bankruptcy court, if they're involved, will allow you to have a certain period from signing to assess, and then from there it's kind of a go no go period to get the implementation going. So a lot of times that's dictated by the bankruptcy court. As far as the long poles in the tent, like I was mentioning earlier, two items stand out a lot here. So the first one I would say is your, physical infrastructure, your technical piece. When you're acquiring, especially in the distressed entity space, there's a couple of factors. So a lot of times they have a neglected infrastructure, right? So they're not in good shape as far as power and network goes. How much can you engage with the acquiring entity to get in there and assess that and bring your power and network vendors to assess what's needing to be happen? Can it withstand putting in a parallel infrastructure alongside of the legacy system? Because what you want to do is continue functioning business as usual until you can cut over that entity. So a lot of times what we do is put in a parallel infrastructure that can be switched over at go live. So there's a lot of planning and procurement, which is out of your hands, how long that takes, that needs to happen early on. The other bucket, and we can dig into the details of that further if you'd like, but the other bucket before I lose it is the third-party landscape. So, your EHR is clearly at the nucleus of this. It's going to drive a lot of your decisions, a lot of your governance, a lot of your project, but your third parties requires a lot of phase zero, if you will, assessment work. Getting the current state application portfolios for both the acquiring and acquired locations and being able to do, a rationalization of what needs to come over, what is going to be replaced by Epic, for example, and what needs to continue on. Things like your HVAC, your tube systems, badging systems, a lot of times continue on, and what needs to happen there. And then quickly you need to move into contracting and aligning the vendors with the timelines, because you can say that you are ready to do this in 6 months' time, but if vendors cannot staff and align to your timelines, you're going to have to mitigate around that. So doing that early is key.
Hopefully, I mean, if there's a distressed entity in there, they're just going to go to the acquiring entity's EHR, essentially, is what you're looking at. There's this concept in software development called MVP, minimal viable product. I would assume that same kind of thing sort of exists where it's like, look, this is what we need on day one, and then we will do X, Y, and Z as it moves forward.
Thank you. That's a perfect segue into this. So minimum viable product, if you're trying to do a rapid M&A, minimum viable product is at the foundation of a project like this. So the acquiring hospitals, policies, workflows, content, standards, if you will, so technical standards, etc., integrations will be the foundation. The reason for that is that you minimize the amount of decision making that needs to happen, or you allow for it to be quicker. You then also minimize the impact to the acquiring hospital and the amount of change management and training and changes to the acquiring hospital so you can continue business as is. So minimum viable product is an important piece to call out here.
This is a massive change management project.
Yes.
What does the team look like for this kind of thing? Obviously, it's getting touched by security, it's getting touched by infrastructure, it's getting touched by, and not only clinical informatics, nursing. I mean, it's getting touched by everybody. But what is the nucleus of the change management team look like usually?
Yeah, to start, that is a really good call out. So if you're going about this as minimum viable product, that means that you're shrinking the amount of build and testing that needs to happen, but you're increasing the amount of change management that needs to happen. And something that I like to say about change management before I get into what the structure looks like is it's a multiplier. So you could have, follow me here with some basic math. So if you have a 9 out of 10, great system, but you only have adoption at 2 out of 10, you're looking at a score of 18. But if you have a 3 out of 10 system that everybody is aware of and loves, and you're at a 10 out of 10 adoption, you're looking at a score of 30. So it really is a multiplier in these instances. And in order to do two things, get adoption and move decisions quickly on a rapid rollout, you need to have the right people at the right spot. So couple things there. You'll have a number of parallel work streams. So you're going to have your devices, network, cyber infrastructure, that technical work stream. You're going to have one focused on data migration. You'll have one focused on your EHR rollout, another one on third parties, and then you're going to have your change management work stream that sits on top. From there, you need to have that triangle effect of having, key leaders making 5% of the decisions. Your work groups are making 85%, but it needs to come down across all of the work streams. So I don't want to get too, without any visuals, I don't want to get too in the weeds of it, but there's a breadth of going across the work streams and then up and down as well, where you need to make sure that technical affects third party affects technical, especially in the land of like medical devices, for example, like integrations, etc. So you need to make sure you have key people that go across your work streams as well.
I'm going to give you a chance to breathe because I just hit you really quick out of the gate. I want to thank Optimum Health IT for making you available and sponsoring this webinar. For those of you who have questions, go ahead and drop them in the chat. We are monitoring the chat and we will try to get to those. For those of you who signed up and gave questions, we have a lot of them. I think there's over 30 questions over here. So what I'm going to try to do is I'm going to go hit some of these questions right now. And I'm trying to put them into categories here. One of the categories is change management and effective transitions. And you sort of touched on the need for really good change management. I would think that's the difference between success and failure. And you defined success really as adoption. Like when we get done, people are using it. What do best practices look like to make that change management score a 30 instead of an 18?
Early on, it's defining what is the delta to the acquired hospitals. So knowing what the change is. So that's step number one.
So we're just going to assume that the acquiring hospital is the standard.
Yep.
Okay.
And then where you find deviations, then you will have an escalation path to approve any deviations. So there's going to be instances where an acquired hospital is a smaller entity. So they have MA staff, for example, doing things that nurses do at the acquiring hospital. So unless you change your staff over, you have to allow for a deviation to allow the MAs to do additional duties. That's an example that I've come across. So there's going to be instances where the businesses are different, and so you have to consider deviations. As long as you're documenting those and taking it up the right governance chain, you'll know what areas need to be trained in addition to current state training that the acquiring hospital has. As far as change management goes, as you get past the assessment and design phase, the key pieces here are communicate frequently and communicate effectively. So understand what the communication channels are and start socializing the change that's coming. And then training is one part of change management, but there's a myriad of readiness activities that help people get used to the system and understand it because you want them to see it more than once. Some examples are workflow walkthrough. You might hear those terms, or there's things called day in the life activities where people actually walk through what it would be like to take a patient through. So training is core to that, but you want to have a number of different activities to start getting that repetition in so that on day one, it's not new to the end user.
At UGM this year, Judy stood up and said, what we've learned over the years, and we're talking 50 years here, is that big bang implementations are better than phased implementations. Do you ascribe to the same concept?
I typically do, yeah. I mean, sometimes you have external factors that don't allow you to go about it as a big bang, but being able to structure and communicate and then absorb one large change tends to be better than a number of changes back to back.
Resourcing a big bang project can be very challenging. You're still running hospitals, right? So they're still functioning, they're still running. In M&A, I think one of the biggest challenges I find in M&A is how do you get people to focus on their jobs because they're worried about the transition? Like, what does it look like, 60 days after the implementation? Are you still going to need me? I mean, people are worried about their jobs in M&A. And I went through a massive M&A project in healthcare. It is hard to keep people focused on the day job.
Yeah, I think one of the things I do want to call out in a rapid M&A environment, one of the assumptions is to pause as much as possible that is more project based at the acquiring organization. So, sticking to break fix and day to day, and then being more all hands on deck allows you to move faster in the M&A space. Different organizations choose a different flavor of that, right? Sometimes they bring in outside entities to help them with their M&A so they can continue with their projects. But in general, when you go through these activities, it's going to disrupt your day to day. So what I've seen with Big Bang is if you're able to put the planning in and throw the people at it, you're able to move into phase two, which is that optimization period, and really melding into one organization faster, where you might have, death by a thousand paper cuts going with, a smaller rollout, and you're not able to move into that phase two.
There's a couple questions on optimization. I mean,
Sure.
do you find yourself saying, no, that's for optimization. No, that's for, do you find yourself, that's like one of the more difficult things is to make sure that people go, no, MVP, this is what we're doing today. Yes, that's important. We will get to that. And that's optimization.
Yeah, I think a couple things. So having your guiding print, if you're truly going the MVP route and then looking at optimization to add as a fast follow, what you want to do is set guiding principles that come from leadership down, that everyone is to stick to minimum viable product, and then have an exception process if there's a true deviation that needs to happen. If it doesn't fall into those buckets, then the key is to make sure that there's an explicit way of documenting optimization so people know that it's not just going into the ether, if you will. Knowing that there's a plan and that it's going to be addressed, and then putting thought into when things can happen and communicating that will help end users buy into the optimization phase.
This is an interesting question.
Sure.
It's okay. So there's no M&A today, but you're going to be an acquiring entity in the future. How do you prepare that organization for being an acquiring entity and the corollary? Like, you're going to be acquired at some point. How do you adequately prepare your organization for that future potentially inevitability?
I might oversimplify it, but really understanding your current state is going to be like number one that pops into my head. So having all of your workflows documented, having your application portfolio documented.
On both sides?
Well, you're saying there's no M&A today, right?
Yeah,
So we're talking about just the acquiring hospital.
yeah, if you're going to be an acquirer or you're going to be an acquired, having those documented processes is good for either side.
Correct. That is correct. So even if we're only talking about half of it, you're going to need both sides at one point. So having the documented tech standards, asset tracking lists, third party, not only the applications, but contacts for your applications, having contract repository, all of that stuff will help you hit the ground running and uncover what the future state will look like faster.
The infrastructure stuff, I don't think it is all that hard anymore because we have cloud and we generally have scalable systems. I mean, if you're on the Meditech route, you're probably on Expanse, I'm hoping, because if you're not, I mean, but that brings up a point. I mean, you could have like a two-tiered, like you got to get them off of this to Expanse, get them over to that. And on the Epic side, the farther they are away from foundation, the more that it's like a two-step thing. It's like, we got to get you over here before we can do that. Do you find you end up having to do multiple steps because of that kind of, you're acquiring an entity that didn't do upgrades over the last 5, 6, 10 years?
Yeah, I think especially with distressed entities, if they were neglected, you're not necessarily seeing everything in the cloud, and there's a lot that needs to be replaced. A lot of these that we've encountered have been like full rip and replace, but we have to set up, parallel infrastructure to cut over at go live. So you'd be surprised how much of that still exists. As far as you were talking about the foundation system side of it, folks that have been on Epic for a very long time, I think there's two factors. If you're deviating from foundation or whatever that equivalent is in your EHR, or if you're going from one organization or one entity to multiple, you might not have extensibility in your system, right? So that is something to consider that needs to go into your pre-planning of, can I actually extend out? Like, do we have a single formulary across all of our hospitals so that we can bring the acquiring entities in, for example?
Successful technology trends that support M&A activity. I think this is along the lines of what I was trying to ask before. Has the cloud made this easier for us, or just a different type of complexity?
Short answer is yes. It just depends on how much the acquired or acquiring entities is already utilizing the cloud. So that is where you run into timeline constraints of like, okay, the cloud might make it easier, but can we move to the cloud in order to do this more succinctly?
Data to me was always a crazy set of conversations. Have we
Yeah.
gotten to sort of a standard that says, hey, we're just going to bring the problems, allergies, meds, immunizations across, and the rest we're going to make accessible, but we're just going to put it over here? I mean, have we gotten to a standard approach to this?
So there are regulatory standards that, are common across, but this tends to be an area that people swirl on because there's a regulatory standard, there's the desire of CMOs, CNOs to have more data accessible in line versus what needs to be available regulatory,
Right. When
right?
they say more data in line, doesn't that like immediately in your head go, oh gosh, that's going to be a lot of work?
Absolutely. So, I mean, data migration as a whole has a number of arms, and you're alluding to them. So, like data conversion allows things to come in line. And then if we go big buckets here, and then data archival, you put it in something like a data repository, like an on-base or et cetera, where you can access the data for ROI purposes or for looking back in someone's chart, but it's not accessible in line. So, I think aligning on scope early on in your phase 0 assessment is key so that you can hit the ground running, because these things take time. A lot of times, you have to engage a third-party vendor to extract the data, especially if they're intertwined, if you're acquiring parts of a distressed entity, and that takes a lot of time. So having that scope framed out is step number one.
I'm trying to figure out this question. So why are outgoing applications not addressed during M&A or transition, and instead typically addressed 18 to 24 months post transaction or transition?
Try to interpret that. A lot of times you need to use those applications for that long in order to transition onto the new application portfolio. Also, if there's something like a transition services agreement in place, usually that dictates, the date of decommission of those systems as well, which tends to be on around 18 months I've seen in the past.
Yeah, this is one of those things where it is a moving car. It's like, and you're required to keep it moving. I don't think you've had any M&A where they said, look, you can close down the hospital for a week and go ahead and do I mean, wouldn't that be nice? But that's never really the case. So you have to sort of figure that out. As I'm looking at let's see, KPIs. Oh, this is an interesting set of questions. KPIs are metrics that demonstrate that it's successful or that change is working.
Yeah, so there's a number of, clinical side KPIs of, adoption of the system that you can look at, providers and their documentation, the speed of use, the efficiency there. But then also on the revenue cycle side of the house, there's a number of metrics to show stabilization, like how quickly are you triggering charges after go live, AR rundown, all of those things. So there's a number of both clinical and revenue cycle side KPI metrics.
Yeah. Let's see. Looking for more insights on IT integration during healthcare M&A. Oh, yeah. So we do have some information for you. You can look at the chat. We have information for Optimum Asset, or I'm sorry, it's the Optimum M&A process. Let's talk about trends in the industry. I know that previous administrations really frowned upon M&A activity and slowed it down. I mean, it didn't cease, but slowed it down. This administration has sort of signaled that they're okay with it. Do we anticipate? I would assume if that's the regulatory environment really does dictate the speed at which these things start happening, doesn't it?
Right. That's correct. Yeah, the M&A has been around as long as time can tell, but as the years have gone by, it has exponentially increased. More and more are acquiring, And as you do more and more of them, a number of them are failing and requiring even more M&A. And there's also a lot of movement in the market on, switching EHRs and maybe merging for the sake of using the same EHR versus a community connect. So we're seeing that movement as well.
Well, that's interesting. So essentially, I'm out in the market. I really can't afford to keep my system running. It's cybersecurity is costing more, the EHR is costing more, the whatever. And I really need to do an EHR upgrade of some kind. And I just essentially say, you know what, it's just easier to become a part of that system. That's where a majority of our referrals go anyway. That's what we're going to do. Interesting. Let's assume you just got hired into an organization. What does the first meeting look like? What are the main things that you want to communicate in that first meeting?
Yeah, I would gather all of the key stakeholders from leadership and understand what the number one goals of the M&A are. What are their drivers? Is it, they share a large patient group? Is there a financial benefit? Do they want to balance load their ED because they already send a lot of patients there? What are the drivers for this M&A and what does success look like to you? Understanding that and aligning with the guiding principles of the system is key. The other piece that we would want to know are, what are you most worried about? And then, obviously getting your data request in very early would be the next piece of that.
Why a third party? I think I know the answer to this question. Having gone through one of these, why bring in a third party to help with the M&A activity?
Doing it time and time again and living through the issues and mitigations and all the gotchas and going through assessments and multiple reps allows you to set a organization up for success. We have standard tools, standard templates, as well as, best practices that we lean on that will allow you to do it faster and then also anticipate some of the areas that you can't control. You can do as much planning up front as possible, but there's always going to be on these rapid rollouts, things that come out of the woodworks and they tend to follow a pattern. So having a partner that's done it before allows you to be more nimble and have a smoother experience.
Right. And there's also the benefit of having the third party come in and say, hey, this is what we've seen in the industry. This is what's worked. This is what haven't. Here are the things that are probably non-negotiables. Here are the things that are negotiable. Like how do you want to do this and what does it look like? Sometimes helps in those conversations. We have a question here. How can an organization secure seller alignment in cooperation with the divestiture schedule while minimizing resistance? That's a big question.
Yeah, I'm just chewing on it for a second. I think a lot of that comes up front with the negotiation of the sale, right?
Yeah.
Ensuring that you're thinking of everything that you need, access to data, access to people, access to doing the walkthroughs, aligning your timelines with theirs. But I think a lot of that comes into, if you do have a third party that has gone through a phase 0 with you, understanding what needs to happen because you need to be allowed to do walkthroughs. You need to be allowed to access their systems and go into their closets and understand the power situation, all of that stuff.
Would this stuff go better? The answer to this question is self-evident too. It's like, would this go better if IT could actually see the agreement that was being signed and say, hey, here's a couple things you might want to consider putting in the agreement itself? I mean, is there standard language you would like to see in some of these agreements that the ambiguity creates a challenge down the road?
Absolutely. I mean, a lot of times you don't have a lot of wiggle room, but just knowing what you could ask for would be helpful. Some of it comes down to what if we don't migrate our data by the end of the agreement? Would you be willing to keep the system up while we finish that migration? Those kind of gotchas that you wouldn't necessarily think of in your initial. But yes, absolutely. Having IT involved and especially if you could have people do a walkthrough before the thing is finalized so that you know that you're dealing with, but it depends on what you're allowed to do.
Yeah, divestitures are another interesting thing because you're not acquiring the whole entity. They're carving off a piece of that entity.
Yep.
And it just, from a technical standpoint, creates just another series of questions that need to be answered.
Yeah,
Like,
on that note, on-prem versus the cloud is huge there too. What we've run into with divestitures is getting the data extracted when there's multiple locations intertwined, a lot of times you have to bring in a third-party vendor and they won't let you in to extract it because there's a number of entities living in one after a divestiture. So there's a lot of considerations with that.
Mike Kramer asked, what red flags might give you pause in acquiring and integrating another organization? So you're looking at an organization, you look at it and you go, they're not even ready to be acquired.
Yeah, I mean, there's a number of things that popped in my head as you said it, but I mean, I think one of the things that stands out is if you walk through and it's, distressed technologically. I mean, they're chronically on downtimes and their devices are coming from 1950s, and they're extremely behind the times. Their systems being out of date and end of life, those kind of things. The more distressed the entity is, the bigger the change and the bigger the lift.
There's part of me, I mean, I understand why they do an agreement without me at the table, without having the CIO at the table. But I want to weigh in on is the financial model they're using and the assumptions they're using on the financial model. I can't tell you how many of these I went through and I looked at it and I'm like, how do you think that number is going to equate to a healthy migration? Like we've done 3 of these already. The number's never been anywhere near that. Why every time you put a financial model together, is it all the way down here? Like it's like, well, they're trying to justify the deal. And I'm like, man, you can justify the deal, but every time you do this, you make IT look bad because there's no way for me to hit that budget.
Yeah, I think one of the things to consider too is that a lot of times people think about the big boulders when they price these things out and look at budget, but then they forget about all the other things that add in. I mean, something as simple as a go live command center costs a lot of money, right? So you want to make sure that you're budgeting in everything. But yeah, third party contracting, even your current third party contracts to expand it to the new system, all of your, device procurement, medical devices, depending on how neglected they are. And that's on top of, the EHR software licensing. And then you got the boots on the ground. That is the more obvious, like how many people do I need to do this? So there's a lot of moving parts. And, we've done a number of assessments and TCOs in this regard and can easily guide on all of the gotchas and the areas that are overlooked.
A bunch of questions about being at the table for the transaction and that kind of stuff. And I understand why we want to be there, but I also understand why, for example, I went through the Providence St. Joe's merger. Let's just call it a merger for niceness, but it's all named Providence now. So we can call it what it is today, which was an acquisition. There's a need for privacy. There's a need for very few people knowing. I mean, if that gets out, it gets in the paper, a lot of people. I mean, you want it to be a phased communication to the organization that things are going to happen. So it really is a need to know basis while you're negotiating that contract. I think more and more CIOs have that trust in the C-suite. And so they're at least aware of what's going on and able to, but they can't bring their team in. Like nobody's bringing their team in except for a very small group. I think, if I think through the M&A at Providence and St. Joe's, I mean, if 10 people knew, that was a lot by the time that the letter of intent got signed. Let's talk about the phases. So there's that phase where you need an awful lot of discretion on who knows what, because you don't want a big communication getting out. But then you have the letter of intent. From that moment on, walk me through the different phases of like where you would get involved and what's happening at those phases.
Well, there's times that we're actually involved prior to the letter of intent. Yes. Yeah, there are times. And so in those instances, the organization is thinking like, what do we need to think about as we are approaching this, right? And starting that early. And I've seen that be very successful of like, hey, these are the gotchas. If you can get this data early, get it so that you can start looking at it. And these are the questions you should have to ask.
That's in divestitures. I mean, everyone knows in a divestiture, it's like, look, these distressed entities are going to be sold off. And I mean, you can get involved pretty early on. But if you have like an advocate and a atrium coming together, those are.
It's a little different. Yep. No, that's very true. Yeah, I guess I was thinking more divestiture. You are correct. But so depending on where we're at in the M&A landscape, but really once you sign that letter of intent, you need to start planning. But ahead of the IT side of the house is the business side, right? Like, how are you handling HR? How are you handling your financial systems? Like, how are you running the business as one entity? Tends to be the first set of questions. Payroll, emails, all of those things. And then, you kind of dive into the IT side of the house.
Yeah. What
And
about, I mean, security gets handled. I mean, that letter of intent, you're sitting there going, okay, well, we could send email to each other. We do that today. That's not a big problem. But eventually, at some point, somebody's going to go, hey, let's connect this pipe to this pipe, and you're going to connect these two entities. I would imagine there's an awful lot of planning and a lot of work that goes into that to make sure that we're not exposing either of the organizations to risk.
yeah, I would say that with any M&A activity, whether it's merger acquisition or divestiture, there's a risk, right? You're putting a target on your back as you're doing any of these, especially if it's a distressed entity, the cyber risk goes way up. So what you want to do right away is engage your CISOs and ensure that you're doing, cyber assessments, ensuring that you know what current state is and what you're going to do in combining these things. But I think you're completely correct in saying that the communication approach has to be controlled. So, before the letter of intent, it's a select few. Afterwards, it's getting a group of key stakeholders in place to say, what do we need to handle right away? And what do we need to do in the assessment? And then what do we need to do in the implementation? Just plan through all of it.
This is an interesting question. By the way, if you have more questions, feel free to put them out there. How do you handle app rationalization, especially if the acquired hospital's app is actually better than what the rest of the system is using? Yeah, I'll let that one hang. And I'm curious, I would imagine that gets handled differently depending on the acquisition.
It does. It's a decision to be made. So if you're holding steady to minimum viable product, you move on to the acquiring hospital's applications and there's no exceptions and that's what you're doing, that's what you're doing. However, it is rare to see that no exceptions are made. So if you like, for lack of a better term, or you uncover that the acquired hospital has a better system and you do want to move everyone onto that, you have to consider that you now have change management for the acquired hospital. What training needs to take place? What integration changes need to happen? If you have devices hooked up to it, what needs to happen there? So it's a different analysis, but it's parallel. It's the same analysis, but done on the other entity. So I've seen it done. It's usually a minority of applications, and it needs to be handled by exception.
So this webinar, we've really focused on the EHR. Do you find these to be handled separately, the EHR, ERP, PACS system, or is it usually one project?
Nowadays, it's becoming one, which makes it quite transformative. So what we're seeing more and more of is that all of these are a part of the big bucket transformation. So PACS is a bear, right? So extending your PACS, the implementation side isn't as big as the PACS migration. Making sure that you have your images coming over, et cetera, is huge. So pre-planning with that. Your ERP is a whole thing in and of itself, depending on if it's on-prem or in the cloud will, affect your timelines and your approach. So what we're seeing more and more of is this large, big bang, if you will, if I could use it in a different way, approach to the entire application landscape.
The entity that's being acquired can almost expect a complete makeover by the time this is done.
That's correct. And that's why change management is so big, right? Because you're changing every piece of the day to day because you're overhauling anything from what their computer screen looks like, to all of the systems in use from HR, finance to, clinical documentation.
Might be getting outside the lane here. We're going to get outside the technology lane. People strategies. One of the things that we're worried about is people leaving the organization, brain drain. Are there different people strategies that you've seen that have worked over the years?
Yeah, so it kind of depends on what type of M&A it is, right? So I'm going to put aside the easier one where you're dealing with divestitures of distressed entities. A lot of times they're excited if, going to be bringing them a renewed
Oh,
infrastructure
right.
system.
Yeah, well,
Yeah. You're upgrading, if you will. And now change is scary for anyone. So there's still a huge change management piece to that. But when you're dealing more with like mergers or acquisitions where like it's not distressed, these systems, it's a business decision. A lot of times getting the right people involved in your work group so that they feel like their voice is heard. And you don't want all the loudest people in the room. Sometimes, the quiet sufferers, you want a mix of that. And getting the right people in the right place, allowing them to feel like they're making the decisions at the ground level, that they know what's coming, et cetera. And then also dovetailing into all that we talked about before with change management, of allowing them to get multiple reps in the systems and understanding what their workflows and what their tomorrow will look like will help as well. Because fear is, is the antithesis of change. So we want to try to dispel some of that.
Fear is a problem. And in the absence of information, people will make stuff up.
That's correct.
And I've just found over the years that it's better to over communicate. It's like, man, you just told us that 3 times, than to not communicate, because they'll make things up and you'll sit there and go, where did that come from? It's like, well, you are telling us what we're going to do. A couple of things here that have given me hope. One is we've done this a bunch and you've done this a bunch.
Yeah.
And there's people who really have a handle on the process who can come in and say, look, this is you're not the first one to go through this. We've done this before. We've seen this. So that gives me hope to have a guide who has been down the road, who can say, hey, look, avoid that pothole, avoid that, like stay on the road. This is the road, stay on the road and we'll be fine. The other thing is that we've gotten better. I mean, over the last 10 years, we're getting very prescriptive. Like we know what we want in M&A, in a merger or acquisition.
Yep.
And that's being really defined up front. I mean, it used to be, well, it's a merger of equals and we're going to find our way as we go. And we found that those things take several years of
Yep.
people being really frustrated before somebody finally stands up and says, what are we doing? Like, we all know we're going to get on a single EHR. Like, why haven't we for 2 years? And why are we still talking about this? Why do we have 3 payroll systems? Why do we have, and there's also this acknowledgement that systemness is good for operating an entity. I assume those things aren't getting pushed back on too much anymore.
No, I will say that it's become a lot more prescriptive, just to oversimplify, your eloquence there, but it's become more prescriptive and more based on a methodology. And to oversimplify, if you're familiar with the agile slope, the goal is to have a phase 0 where you are understanding current state and planning for future states so you can kind of coast down that slope as quickly as possible on a phase 1 that's based in minimum viable product. And then you're going into, after stabilization, into a phase 2 where you optimize and become even more systemness, if you will.
And it's going to increase. The pace is going to increase. So document your processes and know what you have. If you're going to be an acquiring entity, and I could see it in the questions now, we've tried to do our EHR implementations within 30 days of closing. It's St. Luke's University Health Network out of Pennsylvania, and they have a playbook. It's a very clear playbook. And when they go to acquire an entity, they go, here's our playbook.
Right.
And what he communicated, what the CIO communicated to me is that being acquired entities are excited because they're like, man, 30 days, you're only going to disrupt us for 30 days and we're going to be on the new system. And they're just like, look, we've done this enough. We've made these decisions. There's still a couple of things here and there, different systems and different things that you're going to deal with, but the core playbook is the same for every time they go to do the next acquisition. It's good to have a playbook.
It is. Yeah, the more defined it is, the quicker you can do it. And the less deviation there is, the quicker you can do it and the smoother you can do it.
30 days, 60 days, 90 days, 120. If somebody brings you in, I know you're going to say it depends because it does depend, but
You saw my face already. I was like, well,
if somebody wants to do it in 90 days, you'll say to them, you can do it in 90 days. Here's what's going to be required.
yeah, I think if you're going to be looking at a full overhaul, and we're not just talking EHR, you're like we were talking about earlier, your long poles in the tent are not necessarily on the EHR front. You can take, as long as you're building users and the facility structure behind the EHR, they can start using the system. So if you're able to utilize current infrastructure and you're able to merge them onto your third parties quickly, then yeah, you could do it in 90 days.
It's just a lot of work.
It is. And that's why I sit here like asterisks are popping into my head, right? So if you're prepared to go on downtime in certain areas, right? Like looking at go live as not a clean black and white line in the sand, but almost like, okay, we can go live with these items and these will follow later. And maybe you're on downtime. Maybe you're retaining the legacy system for a period of time while you transition that later so you can bring all the rest. So being flexible in your approach to go live will also allow you to do it quicker.
Well, if people want more information on this, Optimum Health IT, that's not Optimum. It's not Optimum Health. It's Optimum Health IT. Just so people get the whole name, they can get information on the website, Optimum Health IT. They can get information on our website, thisweekhealth.com/Optimum Health IT. And there's resources there as well. If they want to reach out, they can do so in both of those ways. Plus, you guys are at every conference I go to. So
Yeah.
if they go to the Chime Fall Forum, they'll see you there. If they go to Vive, they'll see you there. They'll see you. I think you're at him. You're at it. You're at all of them. So
That's correct.
not you, because you're in the middle of migrations all the time. How do you stay sane? Those were very busy days for me when we were in the middle of those things, and you just jump from one to the next.
Well, I'm on a couple right now, but I mean, I sit as the engagement executive with like we said, structure, right? So a strong team. I have program director and it goes all the way down. So I have a team and I can step away here and there, but yeah, it's busy, but I like staying busy.
That's awesome.
Yeah.
Amirah, thank you very much for your time. And thank you, everybody, for joining. We really appreciate the discussion and the opportunity to bring this important topic forward. So thank you. And thank you, Optimum Health IT. Appreciate you guys.
Thank you all.
Thanks for watching this solution showcase with me, Bill Russell. We believe every healthcare leader needs a community they can lean on and learn from. Discover more solutions and join our community at thisweekhealth.com/subscribe. Share this with someone who could benefit from these insights. Thanks for listening. That's all for now.